Good afternoon, everyone. Thank you from around the world, I guess, for joining me today, and want to welcome a very special guest who's joining me on, I think, both of our very first Facebook Live endeavors, Dr. Roger Hodkinson. That without the G, it always gives me a bit of a tongue twister, Roger. So Roger is joining us from Edmonton, Alberta, and thank you very much, Roger, for taking the time. I've never done this before, Roger, and I know you haven't either. Hopefully, we won't make too much of a muck-up of our first debut on Facebook Live. But I did want to share with the people who are listening and watching, if you do have any comments or questions, feel free to put them on, and we'll do our best to get to them. But let me start. Roger, I was not aware of Dr. Hodkinson up until a couple weeks ago, where he sort of burst onto the scene, if we may, with a presentation that he made to Edmonton City Council regarding they were having a debate and a vote on whether or not they should extend the mandatory masking orders in Edmonton. And Roger came on the line to that public meeting and gave a very impassioned plea and a very compelling arguments of why these masking orders were ineffective and inappropriate, as well as shared a number of his thoughts about other matters on COVID. So, but before we get into that, maybe Roger, if you pass it over to you, and you can let the audience know who you are from Edmonton, Alberta.
Well, thank you very much for that introduction and the opportunity of presenting my opinion to a much larger audience. I'm a pathologist by training, which means I've been trained in infectious disease and to a certain extent virology. I spent my entire life in evidence-based medicine with an academic position that included a lot of teaching. I've had important roles nationally with setting the examination for pathology residents. I've been in the trenches of public health for many years as an activist in controlling the tobacco epidemic, taking on the tobacco industry and government simultaneously. So although I'm a pathologist and although I'm not an expert in public health, I've had substantial experience in public health, and by virtue of my actions probably saved a lot more lives than I ever have with a practice of pathology. So I have relevant credentials to make these comments. Essentially, it all revolves around the one of the central tenets of medicine, which is that you should first do no harm. That's the Hippocratic Oath, one of the essential elements of the Hippocratic Oath. And when I survey the scene about what is happening in society, I'm struck by the massive disproportion between the unintended consequences of all these actions, which cut across all levels of society, not just medicine, the total disproportion between that and the actions that are being taken, ostensibly on the basis of being effective. They're simply not effective, none of them, and the focus is totally wrong-headed. It should be on the vulnerable, not on the working well, who have a very, very small risk of dying of COVID. You do not disrupt society because of a risk of, in Edmonton, in Alberta, if you're under 60, the risk of dying is approximately 1 in 300,000. They don't express the stats like that because they don't want you to know them. You don't shut down society for that degree of risk, and you certainly don't do it when the methods that you're using are without evidence-based medicine support. None of them. Whether you're talking about masks, social distancing, closures, or testing, none of it has a basis in evidence-based medicine, and that's where I've lived my entire professional career.
Well, interesting that you mentioned your battles against big government and big corporate interests with tobacco. And this is one of the interesting elements of this is we have seen, relatively speaking, in Canada, very few physicians speaking out about these COVID policies. There seems, in my discussions with many physicians, there's been a complete hesitation and reluctance to speak out in against or opposing any of these measures. And I was actually speaking with one of the physicians in my area just the other night, and it was astonishing to me, Roger, that how understated the consequences of these measures. This physician relayed to me, and it was just like as if it might only be one or two people who are facing harm, and that's not true. There's a substantial numbers of people who are being harmed. The Justice Center for Constitutional Freedoms released a report today, just a blockbuster report of how many people are not getting medical attention, and the numbers of overdose deaths and suicide increases, and I was astonished that a physician would understate it, but I also understand there is a great hesitation because of fear of possible retribution from licensing bodies like the regulatory bodies, College of Physicians and Surgeons, and also just this atmosphere of political correctness that we find ourselves in throughout society today, that you can't have an opinion that is a dissenting opinion, or the fear of public shaming and backlash is just too great of a risk. So I understand now that you've been through those battles long ago, because taking on tobacco and government, I'm sure people would have called you many names in the past as well, taking on big government. But is that when doctors tell me about that coercive element of an investigation into them, what's your response to that? Why doesn't it hold you back? And there are other doctors like yourself who are speaking out, and I don't know of any that have actually seen the threat materialize against them for having a different opinion.
You cut to the very heart of the intimidation that's taking place by our colleges. The essence of the college's complaint, the Alberta College's complaint against me, is that I am undermining the public good, which is defined by the experts that are standing behind the measures being used. So those experts, in my opinion, are all sycophants. They're in their positions because they constantly saluted to whatever was necessary in order to get to those positions of influence. They're scared of their own positions being contrary to the narrative, and so they salute in government's general direction. It's endemic in medicine, but you should not underestimate the fear that the college puts into the average physician if they get what we call the letter. Have I got your attention yet? Is the message. And because of careers and incomes being on the line, there's a general reaction to simply shut up.
And maybe I'll put, this is astonishing because these regulatory bodies, these colleges, are there to ensure that medicine is practiced to the highest degree, that we have competent physicians and surgeons practicing medicine. and this is a great distortion that's happening with all our regulatory bodies. I see, is that now they're also have grown to encompass not just the practice of medicine, but the thoughts that occupy you, and that they have the authority in their views that they can compel speech and diminish opinions. And it's not just physicians. I see this. I've heard similar fashions from engineers, from architects, from accountants. I even had a registered massage therapist who received a letter from his college that even masseuses are being prevented from speaking out. So it is, but I do think people such as yourself and others, Dr. Stephen Malthouse out in BC, Dr. Matt Strauss, Dr. Kovinder Kaur here in Ontario as well, many are speaking out. But there was another good example of this, Roger. Dr. Lawrence Rosenberg, the Chief Medical Officer of Health in Montreal, was on CTV, and he characterized COVID as something akin to a bad flu season. And the bureaucracy pounced on him, and he was the head of the bureaucracy, but between government and the bureaucracy, he had to issue a retraction of that statement. And I think if one was to go back through COVID and look at all the retractions that have happened, the Lancet studies, the Fauci statements, on and on, whenever anybody has had a dissenting view, a retraction is sure to follow. But you've been around the block for a while. You've seen a lot of things. You also mentioned in that address to Edmonton City Council about your knowledge, your experience with testing, with PCR testing, and why we should not base any public policies for health on that PCR test. Maybe you could share a few of your thoughts and why you have that opinion on PCR testing.
Let me draw an analogy to pathology testing and the generation of results generally to help physicians understand what's going on in a particular patient. There's one very important principle in medicine, and that is you do not treat the numbers, you treat the patient. The whole patient, not just the numbers. The numbers are an adjunct, very helpful, but you don't use the numbers to determine necessarily treatment. If you extend that concept to society as a whole, these colleges should not be treating the numbers, the so-called positive cases, which are no such thing, the positive test results, many of which are inaccurate. They should not be treating the numbers. They should be treating the patient, which in their case is society. So I would take this position with all the colleges out there. It's inappropriate and wrong for you to try and silence me by saying that I'm a dissenting view and undermining public health because of all the experts saying the opposite. I would say to the colleges, on the contrary, it's up to you to question the government as to why they are introducing all these policies with such draconian consequences if those interventions are clearly not evidence-based. They are reflex, arbitrary measures that are simply designed by politicians to show that they are doing something. Because if they're not doing something, they may suffer at the next election.
Well, that is clear. I know this to be absolutely true. It's far more important in politics to appear to be doing something than actually achieving any tangible.
Let me tell you how this conversation would have gone when this whole thing started. All right, knowing enough about politics and medicine and interaction, this is exactly the conversations that would have happened simultaneously across the world between premiers and their ministers of health. The conversation would have gone something like this: "Holy shit! Have you seen those numbers? The numbers coming out of Imperial College London, grossly wrong, as we now know. But they were numbers that had to be reacted to. And so the premiers would have said to the ministers, listen, I want to plan on my desk tomorrow morning. It's got to have one singular characteristic. It's got to be obvious to everyone that I'm doing something. So they pulled out all these arbitrary measures that everyone knows last year didn't work with the flu. The WHO is on record as having said so. Masks don't work. No, it didn't matter. There had to be action. It had to be visible. And so all these absurd interventions of masks and social distancing and closures and so on, which are all known not to work, they were brought in simply as an arbitrary political device to be seen to be doing something. It's understandable because those numbers might have been correct. We knew very quickly, especially from the Milan experience, that they were not correct, and that it was the vulnerable elderly people who were dying and the healthy, working well, as I call them, were not. It didn't matter. The die was cast. And the very last thing in politics is that you stand up and say, I was wrong. And so they're now dissecting it, parsing it in the most ridiculous fashion. You know, how many angels can dance in a restaurant today and how many angels can dance in a restaurant tomorrow? The whole thing is utterly arbitrary and absolutely ridiculous. You either shut down completely, viciously, like was done with the SARS epidemic in Toronto years ago, or you do nothing like we did last year and protect the vulnerable in ways that are still not being done in a wholesale fashion.
No, we still see very little change in the elderly and chronically ill who are at risk. But we have focused all our political measures on those who are not at risk. When I look at this, Roger, I can only come to, that we have had such an outrageous response to such an exaggerated risk. And I take it with you, like, there was uncertainty back in March, but it came clear pretty soon that the models were wrong, that the projections were extraordinarily wrong. And I know this is true, back you up, politicians and governments will not admit to wrongdoing or to failure. And we've seen this throughout our history. It was only just, a decade ago that we apologized as a government for the wrongdoing with the Japanese internment camps. Whatever it was, 60 years later. It was only just recently we apologized for the residential schools over government, and people seem to have failed to understand that is the nature of governments. They will not admit to being wrong. But more on the PCR test, like I've watched Dr. Michael Yeadon's presentations, former chief scientist at Pfizer, and also Dr. Carl Hennigan from the Journal for Evidence-Based Medicine, and these people are stating categorically that these tests are most, if not all of them, are false, and these are pretty credible people. I think everybody would agree, and they make a good case for it. And here in Ontario, our Deputy Chief Medical Officer of Health, Dr. Barbara Yaffe, has stated that we're at least 50% wrong, false positives. And, I don't understand why the rest of the medical community isn't stating we cannot base medical decisions, public policy, on a test that we know is wrong as often as it may be right. Like, as an electrician, I would never use a voltmeter if it was 50% wrong. Like, I wouldn't, that's not a smart thing to do. But how is it that all these colleges, all these licensing bodies, all these Um, People, they've heard the same stories that I've had. They've seen the same evidence that I have, I would hope. Um, and I don't see anybody saying, well, this is wrong. We don't base decisions on something that we know is wrong more than it's right.
It's not just that it's a lousy test with that degree of false positivity, and I could speak at some length about why that is from a technical perspective. But it's the consequence of publishing that data on a daily basis in the newspapers, showing a rising tide of what they call positive cases. They are no such thing. They are not clinical infections. They are results of a test that is notoriously bad. And that graph is the principal reason that's maintaining public hysteria totally inappropriately, which the politicians then use as a reason for doubling down on these ridiculous restrictions. All testing of asymptomatic people should stop now. It's totally non-productive. It doesn't help management of people at all. It's simply reinforcing the hysteria that's already out there in spades. It's ridiculously expensive. It's notoriously inaccurate, and it should stop immediately. The only testing that should take place is when you go to hospital because you can't breathe or you have a serious, you think you've got COVID or the flu, which is equally likely. That's the only place where testing should take place, period. It's fascinating that flu internationally has flatlined everywhere in the world. Flu doesn't exist anymore. They say.
Yeah.
The strong supposition, of course, is that there's commingling of the flu that's still out there and COVID, and the relative proportion of the two, we're not sure yet.
Yeah, yeah. I think we've seen all the stats are indicating that we're seeing about a normal level of respiratory virus infections being hospitalized, but they're all categorized as COVID.
You see, it's what's called confirmation bias. This is the real situation. You walk into the emergency room and you can't breathe, you've got a cough, fever, whatever, right? The confirmation bias is we're in the middle of a pandemic, so the first test that's pulled off the shelf is COVID. If it's positive, that's it, done, period. Nothing else is needed. You're labeled as COVID.
Yeah.
And the accuracy of that is highly questionable.
Now, there's the other thing about the masking that I think is important to examine a little bit. And of course, there's been all kinds of conflicting statements from public health and Fauci and different people, whether they're effective at one point, they're not effective at another point. Do you wear them? Don't wear them? But I don't see much discussion about is there any, well, maybe I should say it this way. I don't think you should do anything unless there's a reason to do it.
It's called evidence-based medicine.
Yeah. And, you know,
we don't treat you with drugs for cancer unless there's some literature which says it might work.
Right. And if we know that there's got to be some impediments to wearing a mask, and there better be a good reason for you to wear it if you're, and not just because, well, it's easy to do. You know, that's, but public health seems to have just forgotten that aspect, that there, you know, what is the benefit and what is the consequence, if any? And from your position, for healthy people wearing a mask for extended period of times often, what would be some of the consequences you'd be concerned of, Roger?
I don't think, I mean, there are described a number of potential medical consequences of oral hygiene and so on, and they're there, but I don't think it's really that important. I think that the far bigger issue of wearing masks is it stops social dialogue. You can't see a smile. You can't communicate, which is the essence of our humanity, how we relate to each other. Instead of walking around like morons with these things over our face that totally prevent that. My wife was in a store the other day, and the mother was wearing a mask and the child was not. And my wife never does. Um, because we're like that. We think it's stupid. But the point is, my wife smiled at the child, and the child smiled back.
Yeah.
Because the child isn't seeing smiles anymore.
No. Yeah.
That's affecting their upbringing in a wholesale way,
Yeah.
stopping that development. And to think of that happening in schools is so absurd. The motivation behind masks on children in schools is solely dictated by the power of the teachers' unions.
Yeah.
What else do you want to know? They don't care about education. They care about power and potentially having a disability as a result of this fortunate consequence of an epidemic. Now they can stay home. I mean, I'm outraged at the power of the unions in all of this to be affecting our children's lives.
Well, especially when all the evidence is that children are not at risk of contracting the virus, not at risk of spreading the virus, not at risk from having any illness or symptoms from the virus. It's been quite astonishing, but we know that's true. But we continue to impose these.
And the vast majority of teachers are healthy. If you're getting into 60s or so, and you have some comorbidities and you're vulnerable, then there are ways of handling that, but not for the vast majority of teachers. The vast majority of teachers, of course, are the product of universities. They're woke cubed. You know, they run from any fear. They expect the nanny state to protect, and the unions to protect them from all of life's risks. And here we have merely another example of a life risk. Well, last year, we all handled this kind of risk in the traditional fashion. If we had a fever and a cough, we stayed home. We had chicken noodle soup, we sprinkled it with Tylenol, and we sweated it out until we decided that we were fit enough to go back to work. We didn't need testing. We didn't need the state. We didn't need our employer. We simply were responsible people who handled it appropriately. That right is now being wholesale taken away from the population so that the government is now in control. That's utterly wrong. Personal responsibility should take the fore, and we should not give government this opportunity to control our lives in which we're utterly contrary to our understanding of freedoms and association and dialogue. And in the medical profession, the essence of progress is debate and discussion rather than dictating from on high that this is the dogma.
Yeah.
That's not how medicine works, and it shouldn't be how society works.
No, so here in Ontario, Roger, we've also seen huge amounts of harm done from the denying or rationing of healthcare as well. The Minister of Health here back in June, in a response to one of my questions, stated that we had 250,000 needed medical procedures had been suspended, postponed, and you know that's a lot of people. That's with a lot of needed healthcare, and we're still seeing most of even our family physicians in private practice here will not see patients in person, or we're using telephone health. And you know, what are you seeing in Alberta and with regards to this rationing of healthcare and how you're seeing this impact your community in Alberta?
Well, I mean, I hear all the stories. I've had some personal interaction with people. One was the most poignant conversation I've ever had in medicine in my entire career, and I'll relate this to you. because of the death threats that I've been getting, victim services called me to see how I was doing, which is very nice of them. We had a very pleasant conversation, very appreciative. I was very appreciative. But she then told me that she was not allowed to visit her dying father on his deathbed. It does not get any worse than that. You know, you can cancel funerals, you can cancel weddings, you can cancel graduations, all the other stuff that's going on that we're fully aware of. But you do not do that. The jackboots of government in your face. You do not do that. That was the most despicable description of government intervention into everyday life that I've ever heard in my entire career. It was like a gut punch to me to hear that woman say that. I've also heard from my professional colleagues an example. There's someone right now in a small town out of Edmonton. I'm not going to name names or the doctor, but he's got a septic arthritis. He's got pus in his hip joint. Mm-hmm. And the rheumatologist can't get him into hospital. It's outrageous.
Yeah.
It's simply outrageous.
Well, this is one of the things, you know, we used to use a phrase, you know, if a bedpan falls in the hospital, everybody knows. Like any lack of medical attention would make the headlines in our socialized healthcare system. And this is the astonishing thing for me. We've just, you know, society is accepting of no healthcare for so many people, or such limited healthcare for so many people, and we seem to have lost compassion for those who are needing healthcare, and it's like COVID has just displaced everything within our thinking, and it doesn't matter if you've had a heart attack or a stroke, or if you have a cancerous tumor growing in you. Those are all unimportant as compared to COVID, and I really find it disturbing that we've been so accepting. This level of fear has so captivated people that it's displaced our compassion.
Those practical consequences are everywhere, and those detailed experiences are merely a translation of the fact that the well is not bottomless to fund healthcare. I was listening to a podcast in Ireland the other day. It was someone who was aware of the amount of money that's been spent in Britain, which has got the best documented statistics of all of this, of any country in the world. And it just blew me away when he said this: the total cost that Britain has borrowed from our children's future, the total cost of borrowing at this point in time, purely because of COVID, to increase the national debt, is 3 times the entire national budget of the National Health Service, that's already suffering from lack of investment and services. They pissed out of the window 3 times the annual budget of the entire system on one condition that had, with interventions that had no evidence base. The well is not bottomless.
Yeah.
And these countries are spending money all over the world chasing a phantom. And it's our children that will be paying the price for this, with either increased taxes or reduced services of various kinds, or both. That's how outrageous this is. The scale with which they are dishing out money is unprecedented.
And getting little in return.
Nothing in return except damages, compounding damages, business bankruptcies, suicides. The whole, you know, people don't realize that the engine of the economy are not the Apples and Fords of the world. They're small businesses by the thousands who are paying payroll taxes to government. That is the engine of the economy. And you don't have to be a rocket scientist to figure out if you say we're going to close schools, well, guess what? you're closing the economy, because a lot of women are going to stay home to look after the kids, and they're not going to be working in their usual job. I mean, this isn't rocket science. I call it, it's not idiocy, it's lunacy. In the medical profession, we commit people to psychiatric institutions for less than what's going on today politically.
Right. Yeah, well, I think this is clearly something that people are not thinking about, or it's unimportant, is, the level of debt that we've taken on in this country. We have a yearly deficit 10 times what it was last year. Yeah, $380 billion. That is debt that has to be repaid, and we're not going to be able to build new hospitals. We're not going to be able to build new education facilities when we're paying all that debt back. But we seem to be heading for the cliff, and that we really want to get to the cliff as fast as we can for COVID. It is astonishing. But one other thing that I'd like to chat about a little bit, Roger, is the social determinants of health are known. Good access to healthcare, good education, good standard of living and through employment, and our public health officials, in my view, have attacked every known social determinant of health in their response to COVID. And there's been no discussion, no debate about what the long-term consequences will be for attacking the social determinants of health. We've got any comments on, this is known. We know that these things improve our life expectancy in our lives, and we've just disregarded them.
People have got used to the state protecting them from any and every risk in life. It's a product of the universities over a period of 20 years to develop this concept of the nanny state and the wokeism that's come along with that. Individual responsibility was working very well in the past. In this particular case, as I described, you knew you had the flu, you stayed home, and no one else was involved. Unfortunately, government wants to increase its infiltration of everyday life, controlling this and that and whatever, with regulations that are totally unfounded. This is merely one example of a much bigger trend in government to take control of us.
Yeah, well, I do agree with you. I see this in that, over my lifetime, and especially over the last 30 years or so, there's been this relentless erosion of personal responsibilities, in government prescribing how people will function, prescribing what you will do, not just outlining what you ought not to do, but telling you how to do things, and often at the behest and at the demands of elements within society, and so we've really have created in the process an irresponsible society when government takes individual responsibility.
The essence of the Achilles heel of democracy is called freedom, because freedom only works if it's exercised with responsibility, and currently it is not being exercised with responsibility in so many spheres of life, of which this is merely one example. We need to understand that if democracy is going to survive without some unfortunate revolt against control, then individual responsibility has to return. And that involves risk. There's the unfortunate reality of life is called death. It happens. Get used to it.
Well, that is another thing that has been astonishing to me, Roger. And I agree fully that freedom without responsibility is a non-starter, just as responsibility without freedom is a non-starter. That coin has to have those two facets for it to have any value. So, but this is interesting in the conversations this year that I've seen through COVID is it's a bizarre, and I think it's as a result of the government constantly putting out these numbers of cases, or constantly every day relentlessly, 2 people died or 5 people died, and it seems to me that there's been a distortion of understanding that people aren't realizing that thousands of people die every day in our country, every day, many thousands.
Internationally, the adjusted mortality rate in any significant country, even with the COVID epidemic, has not changed. The same number of people are dying as died last year. Right. There is no massive emergency here. ICUs are not overloaded. ICUs normally have a run on beds in the fall because of the flu. This is normal. Yeah. There is nothing abnormal going on except the graph that's in every morning paper that shows it's getting worse, which it's not.
I don't know if we have any questions that may be showing up on the screen. I know there's if people do have questions that they'd like to pose to Roger, feel free to put them on Facebook, and we'll attempt to get to whatever questions. And I see we've got some coming up. Here's a question, and I'm not sure how to respond to that one either, but I'll put it to Rick. Has asked, why do you believe that the military is being used to roll out the vaccine in this country? Do you have any?
Well, I mean, they have logistics capability that are ready to go, and I have no problems whatsoever with the military getting involved in distribution. It's under control. It's efficient. They've had experience at it. It's a very sensible solution to me. What I do think about vaccines is that it should be purely voluntary. Yeah. I think it would be absolutely draconian to extend this government infiltration of our daily lives, to have a stamp in your passport or a chip in your arm or something that government determines that you're now able to travel. That would be outrageous. It should be nothing different from the flu vaccine. If you choose to have it, take it. If you don't want to do it, don't do it. End of story.
Well, that goes right back to our comments about personal responsibility. You need to have that freedom of choice, and judge your own circumstances, judge your own level of risk, and do your own investigation, make your own determination.
Yeah, I'm not an anti-vaxxer, all right?
No.
Vaccines have a huge place in society.
Yeah.
Would I take a COVID vaccine given my age? I probably would. I take the flu vaccine, I take the pneumococcal vaccine. It would be sensible, I think, and I would assume that the safety measures that have been taken before it was authorized for distribution, I would put my faith in that established process.
Yeah. No, we have seen countries such as Australia take a very, very, and even the province of New Brunswick attempted to do for all intents and purposes, a mandatory vaccine and taking away people's choice. There is another question here. I'm not sure. The question says, how can we tell the difference between asymptomatic and false positive? I'll let you have take a kick at the can on that one.
Well, if you're asymptomatic and you get a false positive test, which should never have been done in the first place, God only knows. It's a crapshoot. You toss a coin. I mean, we don't know if it's a false positive. There's no way of knowing right now. There's no confirmatory testing of these lousy results.
Yeah.
It's just a technology that's not available.
Well, I think it's also interesting how so many new words have entered the common lexicon of our society today. Like, never in my life did I use the term asymptomatic before the 2020. And
let me give you another name that I've introduced into society. You know, there used to be a time called BC, right?
Yeah.
Way back in time.
Yeah.
Well, there's now BC and PC. There's before COVID and post-COVID.
Post-COVID. Well, if we're not careful, it will be a very significant turning point in human history. But here's another
I tell
one.
you, a turning point. Let me put a point on it. I said it publicly and I'll say it again. I'll underline it in neon. This is the greatest hoax ever perpetrated on an unsuspecting public ever in human history.
Yeah.
It's on that degree of scale. And everyone should understand that.
Yeah. So here's another question from Stephanie, and I think this is an important question as well, is why is vitamin D, and C and zinc not being spoken about, and why is it being overlooked? And what impact do you think it would have if it was recommended?
Well, vitamin C is a non-starter. There's not much evidence for that, but there's strong evidence for vitamin D and to a certain extent for zinc. The value of these interventions is that, first of all, they're dirt cheap and they're non-toxic. There's enormous evidence, especially in Britain. Anyone that's listening that wants to log into Dr. David Grimes, Grimes. He's the lead in Britain for advocating that vitamin D be supplemented as a prophylactic against COVID, particularly for elderly people who are inside, who are all vitamin D deficient. Vitamin D doesn't just have powerful effect on bones and calcium metabolism, but it has a totally different, powerful immune boosting effect in a general sense. It tones up our immune system, if you like. And every person in a nursing home or with comorbidities should be taking at least 5,000 international units of vitamin D every day and 50 milligrams of zinc.
Well, that's an interesting point, and I've made this point previously, that never during COVID did I ever hear anybody from public health talking about other measures that you could take. Like we've all known since we were little kids, when our moms and dads used to tell us to get outside and play in the fresh air and get some sunshine and be healthy. But I've never heard Dr. Tam once, or Dr. David Williams, or Dr. Bonnie Henry, or any of them ever say anything about vitamin D or zinc.
That's why it's so wrong-headed. All the focus is on controlling 60 and under. Yeah. All the focus is on the people that are not going to die. Mm-hmm. Totally wrong-headed. Yeah. Because as you said, there is no publication of all the measures that should be taken to protect the vulnerable. And there are a huge number of issues here that should be implemented simultaneously for every person that is vulnerable to COVID with comorbidities. There should be supplementation of vitamin D and zinc. There should be education of the aides that are helping in the nursing homes, who are often poorly educated. It's not a racist comment. They're often from places where they don't speak good English, they don't read manuals, they don't understand infection control, the meticulous nature of infection control. They don't understand that. That's not being emphasized. The other thing that's not being done is this awful consequence of the social deprivation of people in these nursing homes who are being deprived of contact with family. Yeah. there should be, given we're in an IT age, there should be immediate implementation of user-friendly interactive video so that everyone can keep in touch. That's not happening.
Yeah.
And that's just as important as testing for something that shouldn't happen.
Here's a question, Roger, that I think is one that has been talked about a lot because, back in February, March, this virus was supposed to have the properties of every virus. It was highly contagious, the severity was great. The infection fatality rate would be monstrous, huge. The RO was, it had everything. The potential was everything. But here's a question. How real in medical science is the fact that an asymptomatic person can transfer a virus to someone else?
There are three principal tenets of how infectious a particular situation is. The first one is the dose of the organism. How much of it are you getting in your body? Beyond a certain threshold, it's likely to create an infection. Below that, it's probably not. The immune system is extraordinarily effective at knocking off bugs that are invading our body all the time, particularly from our bowel. We don't realize it, but it's happening all the time. Probably millions of hits a day that we're unaware of. The immune system's clearing out. So that's the first tenet, is dose. The second tenet is what we call pathogenicity, the virulence of the organism. How bad an organism is it? Is it like the common cold, or is it like Ebola, for example? Obviously here we're dealing with an organism which doesn't have very significant virulence, except when it's getting into the system of someone who has a very vulnerable general medical condition. And the third thing is route. So it's how much, how bad is it, and where's it getting in? Is it getting into your veins if you're a mainlining drug addict, or are you breathing it in, right? So those are the three things. Obviously, if you're asymptomatic, you have a very low dose in your body. And therefore, by implication, if you're shedding at all, and the evidence would suggest that shedding by asymptomatic people is virtually unimportant. Obviously, from a theoretical perspective, there's much less in your body. Therefore, whatever you're doing, coughing and speaking, it's an insignificant dose that you're giving to the general environment in an aerosol everywhere you walk. There's that additional dilution, of course. When last year, when you were standing in a lineup at Safeway, you tended not to cough over the person in front of you. We didn't have to be told not to cough in someone's face, right?
Yeah.
This is how mad this thing is. I mean, well, the aerosol, I liken it this way. When you walk into a grocery store and you've got these stupid plastic bags that won't open. Well, this is what I used to do. Yeah. I'd lick my finger to open the bloody bag, right? So I got spit on my fingers.
Yeah.
And then what do? I squeeze the lemons.
Yeah.
So this virus, the concept that an upper respiratory virus can be contained by these measures is utterly ridiculous. It was global from day one. The genie was out of the bottle. You couldn't conceivably put it back by any measure imaginable. And so the natural reaction should have been to accommodate to it in practical ways, which we know didn't happen.
So here is a question. I think that's a really good question, Roger. Since you've gained infamy in the internet world, and I have to say this to everybody watching, Roger does not have Facebook, and he doesn't have YouTube, and he's up until today he has a cell phone. But of course you sparked a lot of internet censorship, including my YouTube channel has been taken off the air for 90 days because I had the audacity to replay your comments at Edmonton City Council. But here's the question from Kim is wondering if Jason Kennedy, the Premier of Alberta, has reached out to you. And maybe that's an unfair question or not, but that's what Kim has an interest in, if the Alberta government has reached out to you at all.
Let's say it's a deafening silence.
Well, you know, I know.
Let me just say one thing though about Premier Kenny. As much as I think he's made bad decisions from the get-go, aided by his medical officer of health, he is unique amongst all Canadian premiers of having stood before the microphone last Friday, I think it was, in an totally unscripted, obviously contrite apology, in which he said, and I'm quoting his very words, "It was a stupid mistake, and I apologize." And he was referring to the lockdown in the spring, to which my reaction is extraordinarily appreciated, totally unheard of in politics, to stand before a mic and say you were sorry. But, Premier Kenny, if it was wrong then, it's even more wrong now, because you don't treat the numbers in the morning paper.
Well, that's, I have to agree with you. Premier Kenny is the only premier, as far as I know, in the country, who has stood up and recognized that, and I think he's probably also the best one, the one who has best tried to prevent further outrageous restrictions from happening.
But what he has done is a typical political device of kicking the can down the road to other jurisdictions.
Yeah.
You know, I'd like to think that the Ministry of Health here has the best repository of experts or access to experts to advise the Premier and the Minister what to do. If that is the case, you do not kick the can down the road to all the municipalities to make their own decisions, because they just don't have the resources.
Yeah.
Where I live, in a rural area, the person that's advising the local council is the fellow that's running the fire department.
Yeah.
Mm-hmm. Now, that becomes ridiculous.
Mm-hmm.
He should have taken the responsibility of advising them all what to do, or dictating what to do, mm-hmm. which I think should be nothing.
Yeah.
But that's beside the point. You do not punt the responsibility to people that you know don't have the resources to make the decision. That is bad policy. The other thing that I would say is there was a delicious expose of secret recordings between our medical officer of health and Kenny and the minister. And the net result of those conversations was that the medical officer of health, who had been responsible for many bad decisions, in my opinion, previously, actually in those conversations made the right decision. She said to Kenny and the Minister of Health, there should not be a testing of asymptomatic people. That was the right thing to do. They overruled her. That, given the consequences of instituting that process of asymptomatic testing, that should have been a resigning decision for the medical officer of health. She chose not to do that, to salute in their general direction and do something that she knew was not correct.
Well, there gives another example of why individual responsibility is so important, Roger. If I agree with you that a medical officer who provides advice to a government and that advice is rejected should resign. Just as a political minister, for whatever wrongdoing that might happen in their ministry, the saying the buck stops here. Ministerial responsibility. You have a duty to your constituents. You have a duty to the crown, and you have a duty to yourself to resign. But listen, we've been on air for an hour. I don't even know if we call it being on air now or on the internet for an hour. I want to thank everybody who has tuned in and watched. I want to thank you, Roger, for taking the time to share your thoughts and your insights with everybody on Facebook. And, I think a takeaway for me, what you've shown is things change when people speak out. So whatever avenues, whether it's at a town council meeting or wherever, speak out and speak your mind. And
I'm not going to stop.
and you can be certain that I will not be stopping either. We'll champion free speech and a return to sanity road. Thank you very much, and thank everybody for watching Facebook this afternoon.
My pleasure.
Bye-bye.
Thank you. Bye-bye.